good stuff's happening out of that. They want to join Greater Fall River, or New Bedford, and we already have.
Hi, I'm Brenda Weis, the Health Director for the City of New Bedford.
Hi, and I'm Paul DeLuey with the Substance Abuse Grants.
Also for the City of New Bedford. So we're here today for a regional summit to talk about the opioid crisis in our region and what solutions we can come up with as a region to address the crisis. These communities came together originally as a coalition with Dartmouth, New Bedford, Marion, Rochester, Mattapoisett, and Wareham through a grant from the Mass Department of Public Health Bureau of Substance Abuse Services called the MOPSI grant. So the MOPSI grant provided funds to create a coalition to address first use and consequences of opioids on a regional level. So we've been meeting for the past 6 months, I guess, as a coalition. We brought in our New Bedford Chana, which is very interested in working in this area, Mike Jackman and Perry Mello and those folks. They are also partnering with us on this meeting to come up with our needs and gaps and strategies. So we were lucky today to have 3 plenary speakers. We had Mayor Jon Mitchell, we had Congressman Keating, we had Representative Koczera, and we had Gerry Kavanaugh, who's the interim Chancellor for UMass-Dartmouth. And I want to say Gerry was really heartfelt in describing what's going on at the UMass campus and the awareness that's been raised. It's really great, and he gave a voice of commitment to the coalition and to the region today. And I think I've never seen that in the 3 years I've been here at that level, and it was super powerful. I thought Congressman Keating is, of course, wonderful, and he's 100% behind us at a national level. Representative Koczera communicated to me that there's a lot of policy issues here, a lot of legislative issues, and he's anxious to take those on. He has a cable show that several of us have appeared on recently for opioids. So all in all, it was a really good open to the meeting, setting the stage for the hard work that the workout groups are going to be doing right now. So tell them about the breakout groups, what the format is.
We have a number of questions to kind of be a catalyst for the conversations. Right now they have set up the sheets on the wall where they are brainstorming all their ideas with these groups. And I'm looking around at some of the groups, and they're very diverse. I mean, I know that this one is heavy
treatment and recovery
with the medical professionals.
Right? Medical professionals, yeah.
But I'm seeing police, community activists, youth advocates. We've got a big mix as far as education, prescribing practices, treatment and recovery, and access to treatment, and education. So everybody has got the opportunity to add to this list the gaps, the strategies, where we can start, what needs to be tackled first. And I'm looking around, and the papers are filling up fast, so there's a lot to be said.
Right. So the goal of today's meeting is to come up with 3 priorities in each of these 4 areas as a breakout session, so that we come away with at least a list of 12 top priorities for our region. And why are we doing that? Because we have funding at our department, but there's also a lot of funders that have come forward asking, what can I do? And even today, UMass-Dartmouth made a commitment to funding as well. So we have the Carney Foundation, the United Way, the Chanas, all saying, I want to do something. And so we hope this list of 12 or more top priorities, probably more than 12 when all is said and done, that people can say, hey, I'll own number 3, or I'll own number 4. But it gives folks in the region, especially funders, an opportunity to say what they'd like to invest in. So that's one of the big goals today.
And then on a side note, that one of the things that I'm happy to see is we're bringing people together that I don't think normally would have crossed paths. And there's a number of groups that want to work on the same things and can now collaborate. That's the most exciting thing for me is the handshakes, the conversations. That sounds like a great idea. I want to join on. That's the biggest thing for me that I see this
I think
morning.
it's huge.
Yeah.
And I think we need it. We can't move forward unless we decide we're going to work together.
Yeah, we're not going to tackle this by ourselves.
No way. It takes a village.
This is going to be, we're going at this with the size of an army today.
Yes.
Are there any programs that have come out of that? Or is it a community discussion awareness, or?
It's an awareness, yeah. It's an awareness, and actually we're doing the knock hands in schools. So we've developed a website that people can access for resources and referrals. Actually, it's Rachel Davis, she's a self-help. So the online resource.
Oh, it's the one from
Self-help, yeah.
Okay, well, let's put that one.
Yes, and just in line with that too, that Rachel Davis and South Coast and Stephanie Perry from St. Anne's Hospital, they are the co-chairs of the Substance Abuse Task Force, was underneath the Partners for Healthier Communities. Stephanie Perry. Stephanie and Rachel. Stephanie Perry is together, and they're co-chairs of our Partners for a Healthier Community, which is our CHNR. We have a Substance Abuse Task Force, and they're co-chairs. And they
Is this?
No, that's different. Two different, yeah. And they,
So where is this? Fall River?
Yes, Fall River. We need to, obviously, here, by making me more aware of that, we need to bring these two groups together.
And this substance abuse task force is where?
It's underneath the umbrella of our CHNR, which is our Partners for a Healthier Community.
So does it serve our region?
It
Or is it
serves
one
Greater
town?
Fall River. Fall River. And which includes Westport, which is in this region.
And what are they, do they have any programs, or is it an awareness, sort of get the conversation going thing?
We are doing work in the schools, do trainings in the schools. We do that you have in New Bedford. We're trying to bring Learn to Cope. Okay, we're trying to bring that to St. Anne's Hospital. Be the host site. We have room reserved. We're just hoping that the VSAS will extend. I know that Bedford has that currently at St. Luke's. So we're trying to bring that, and then we're just a number of, we just had a strategic planning meeting, February 23rd, so.
Okay. Any other?
I can speak to a little bit of the training in schools. Yes. The school nurses have been trained by the Department of Public Health in the administration of
Which one of these? Or is it a different? Okay.
The Department of Public Health has trained all the school nurses in Narcan administration. School physician has written protocols. What other services? Narcan should be in 4 schools in the next couple of weeks.
So they can actually.
I have already spoken with school committee while I go on Monday to get the final school.
Yeah.
Certainly to support the program, and they're gonna.
Is this being done?
This is Fall River. Bedford also does.
We already have Narcan in every school. We have 2 doses in all 24 schools. All 30 of my nurses have been trained in it. And we also do a lot of trainings life skills in our health education classes.
Okay, where is life skills?
So 70 Hills is level right now.
I'm sorry?
Middle school level right now.
In the
The
Fall
health
River?
New Bedford. I'm New Bedford.
Have to be a substance abuse funded program. Any other? I want to go back to you.
Like the Chancellor had said that earlier, but they just finished a program.
Seven Hills provided that to UMass-Dartmouth, so to the students, so we're able to, provide that. What other? Are you aware of any other programs where? The group that we talk about, those target groups can access Narcan or treatment.
I just wanted to add, at the statewide level, and this is something people might not be aware of, but we have the Bureau of Substance Abuse Services helpline. So there's a 1-800 number, and there's also a website available. 1-800 number, if you call, they speak multiple different languages, so they'll find somebody that can assist you. They work very closely with providers, families, potential clients. So as far as accessing services, they can go to that website, they can locate a program, they can get more education on what those services are in their community. And then we also have, there's a website called MABA, M-A-B-H-A, and it's a collaboration with MBHP. And what we do is detox programs, stabilization programs, transitional support programs. They update this page, so they'll call daily, or with detox programs, it's 3 times a day. So it's not a live page, but I mean, it gives you a pretty good idea. If you go to that website and you're looking for a bed, either for yourself or for a loved one, you can go there and you can say, okay, I'm looking for a bed at this facility. There were 3 beds available 2 hours ago. Contact that facility, gives you a better chance of getting, you know, a bed or the services they need.
What was that website?
MABHA.
MABHA.
Are you using it as a physician?
Yeah.
So you use it. And what are some of the barriers that you find to use it other than it's
Time.
at a point?
Always
Time.
Always
Get away.
And do you use it to
No.